welcome everyone to this session. Our main goal was really to bring everyone up to date and hopefully convince you of what Mark said. We have butted up and moved beyond the tipping point for this project. It is going to happen. It is going to be a spectacular addition to the campus, and I would just like to amplify a few things that have already been stated by both Mark and Cindy. Why is this so important to UCSF? I think Mark went over the facilities piece and our need to enhance our patient care, but stepping back and thinking more broadly from a campus perspective, this is a key part and a key next step for the expansion of the campus. Of our various missions, the clinical enterprise touches all of them. It's critical to our education missions, it's critical to our research missions, and it's a big part of what we do in public service. And increasingly, the financial engine that drives all of those missions comes from our activities in the clinical arena, both through the medical center and through the physician practice in the School of Medicine. We need to expand those practices in order to achieve our aspirations in all of the other missions. So this is good for patients. It's what we need to do to be able to continue to provide cutting-edge clinical care, but it is also a key, critical business strategic move for the campus as a whole. Now, clearly, when you're building a huge new facility at one site, it tends to take the energy of the enterprise to that site, but I would like to pick up and amplify a point that Mark made. This is a key tactical decision that is part of a long-range plan for all of our sites on the campus. It will allow 3 of the 9 patient care floors, so 30% of the space that is currently devoted to direct patient care on the Parnassus campus will be vacated for reprogramming and expansion of programs on this site, and it allows us to revision the Mount Zion campus in an entirely new way. So this is clearly a huge project at Mission Bay, but it is a project that is in the context of everything else we are doing at all of the other sites and benefits enormously all of those sites. We've touched on the opportunity for translational medicine. Clearly that occurs at this site and will continue to occur at this site and Mount Zion in a very favorable way. But part of the architecture and part of the thinking around the design of the hospital has been to embrace what we now call translational medicine and to be able to do it in a fundamentally enhanced way on the Mission Bay site. And one of the really exciting things about that site, Cindy showed you the aerial view of the site with the view downtown to the city. Well, north of the campus, there will be an enormous explosion of housing, particularly for young families, and that's a key part of the positioning of the hospital. But to the east and west and somewhat to the south of the site, the area is zoned for biotech development. There are already 16 biotech companies that have moved into that site, all within walking distance of the campus. And part of the design of the community center and other aspects on the research side of the campus has been to draw those people in as what is the sort of fourth leg of the traditional stool. We talk about basic science, we talk about translational science, and we talk about clinical care of being the 3 things that we need to do to advance health. But in truth, what's been missing for many, many years, and at most places around the world, is that fourth leg to the stool, and that is the very close dynamic interplay between us and commercial biotech and commercial pharma. And obviously that can occur at a distance. We can work with Merck on the East Coast, but the ability to do it in such a close temporal relationship gives us, I think, a unique opportunity, unique internationally, to do something really special at Mission Bay. And finally, and Mark touched on this, is the success that we've had in fundraising for this project so far, and for the pipeline that we can't talk about publicly, but makes us extremely comfortable and confident, and I would add my high degree of confidence that this project will get done, and it will get done on time. And we've been able to reach out to really a universe of new donors through this project that will come in and support this project, but also many other projects that we are conducting across the campus. And we've already seen that cross-fertilization of our community volunteers who are now behind the Medical Center and behind UCSF in a way that they fundamentally have not been in the past. And that, I think, speaks not only well to this project and gives both Mark and I the confidence that this project will be done, but gives us both extraordinary confidence that our next project and long-term support for the community is going to be stepped up in a way that we haven't seen before. The new Chancellor, Sue Desmond-Hellmann, has indicated that this project is her #1 project to get done, and I would say from the School of Medicine, I will echo that, and this is our top priority to get this project done, not only because of this project and what it stands for, but because of the halo effect and the impact that getting this project done will allow us to advance in all of our missions and across all of our sites. The next 4 years are really going to be historic for UCSF. It's going to transform a neighborhood in San Francisco that has seen very hard times in the past, and will allow us to partner with areas of our local community in ways that we haven't been able to before, and I think will transform the image of UCSF for many people in the city and county of San Francisco, and will undoubtedly transform the image that we have internationally because of this extraordinary opportunity at Mission Bay. So I will stop there, but before I invite Mark up and where all three of us can take questions about the project, I would just like to say a couple of words about Cindy's leadership on this project. It has been extraordinary. She was not there right at the very beginning, but at a point where we were faltering and where it was not clear whether we were going to be able to push through some of the obstacles, both organizational as well as financial obstacles, to keep this project going. She stepped in and has really, I think, done a spectacular job in pulling the team together and just being able to drive through any number of obstacles to get us to where we are today. So before we take questions, I would just like to suggest everyone give Cindy a round of applause. So Mark and Cindy, do you want to come up, and we'll now take questions?